I saw a patient not too long ago where she had completed 2 IVF cycles at a very reputable IVF center. And the patient's 38 years old, had not had any children before, went through conventional or standard IVF with Lupron and FSH and gonadotropins and Minipure. And at the end of the day, had what appeared to be a very good stimulation. She produced 18 eggs. Of the 18 eggs, she had 15 of those eggs fertilized. And of the 15 eggs that fertilized, she had 8 embryos that went on to form blastocysts. And all the embryos were tested for genetics, doing the pre-implantation genetic analysis for aneuploidy. And all 8 embryos were genetically abnormal. And that kind of caught the doctor off guard, not knowing that everything was going to be abnormal as well as the patient. And they thought, well, it just may be bad luck, let's try it again. You're obviously a good responder to medication. So they didn't change the protocol much. They had another similar response where they produced 15 eggs. Of those 15 eggs went on to have 13 fertilized. And of the 13 that fertilized went on to develop 7 blastocysts. So they thought clearly, if you combine the 8 from the first cycle and 7 out of 15 embryos, there's got to be something normal. So they went ahead and tested all 7 of those embryos, and they all came back genetically abnormal again. So at that point, they sat down and had a heart-to-heart, and the doctor, with all his experience, told the patient, you've done as well as any patient at 38 has done in terms of forming blastocysts. Our expectations are not any better. And the fact that you haven't produced any normal embryos causes me to arrive at one conclusion, which is that your eggs are bad. They're not healthy. They're not going to form a healthy embryo. And your only logical next treatment option is to do donor egg IVF. Well, the patient took that information home and found our clinic and came to see me, and I talked to her and said, well, you are a great responder to medication, but let's try a different technique where we do minimal stimulation IVF in hopes of having a more gentle stimulation approach and having better quality eggs, better quality embryos, and hopefully a pregnancy. So from that, we use a combination of oral medication with every other day injectable medications. So to give you an idea, she was using 450 units a day of gonadotropin. At the end of the day, I was using 150 units every other day. So a much lower dose of medication. She went on to produce 8 eggs. Of the 8 eggs that were produced, 6 fertilized. And of the 6 that were fertilized, she had 5 formed blastocysts. All 5 were biopsied and sent for testing. Of the 5 tested, 2 of those embryos were genetically normal. So we went ahead and planned a frozen embryo transfer one of the embryos, and she went on to have a successful pregnancy and still has an embryo left over for a future pregnancy. So that's a perfect illustration of essentially the patient being her own control. She did one technique and had one result, and then by changing the stimulation protocol, using a different technique, had an entirely different result that we've seen over and over again in patients that have failed. And that's why a lot of patients that come to see us are patients that are told they have no option other than donor egg IVF. And this is where minimal stimulation and natural cycle IVF hold a lot of promise for these patients,